let's just talk a little bit about therapeutic communication. Some of this comes from the stuff that we did in nursing school, but a lot of it actually comes from being a VIP instructor. So Franz is a VIP instructor with me. So a lot of that is negotiating and learning how to talk from those things, and that's where a lot of the things that I've learned have come from. When did I click communicate? Just did. There we go. Okay, so the first thing is just to kind of understand what therapeutic communication is. So it's any face-to-face interaction that is centered around the patient's both emotional and physical well-being. So the biggest thing that they're pushing for us is to make sure that it's the patient-centered care. So we're making sure that we're including them and making them feel like they're a part of all of the communication, which is going to, in the long run, hopefully help them be more compliant and work with us because they feel like they're participating. So in short, how do we do this? So the biggest thing to start off with is knowing how to actively listen and how to do it in a way that the patient feels paid attention to. So for any of you guys, who are the people that you enjoy listening to? Right? Participation in general. So just in your life, there are people that you like to listen to.
Well, not my boyfriend. Friends, family.
Okay. All right. And what it is about the people that you like to listen to, why you like to listen to them.
I'm invested in what's going on in their lives.
Very good. Anyone else other reasons that you like to listen to people?
To laugh.
The comedian is a good one. All right, so you said not your boyfriend, but really, who are the people that you really don't like to listen to?
Maybe people that like depress your mood, that are just in general.
Just like Debbie Downers?
Yeah.
Yes. Okay. So it falls under the why you don't like to listen to them because they bring you down. There's one girl at work I just don't like to listen to because she is very like negative about everything. So I'm just like, I just don't want to hear what you have to say. So paying attention to things of the people you like to listen to and don't like to listen to, and taking away what you could do to be a better listener as well. So kind of thinking about if someone was listening to me talk, are they going to like listening to what I'm saying, or are they not going to like listening to what I'm saying? That was for you. I want you to know.
I love it.
So then we go into kind of our active listening, which I'm sure you guys have covered, so I'll do it briefly. So maintaining eye contact. You want to make sure that you are completely invested in paying attention to them. To make sure that you don't interrupt, because generally when we interrupt, it means that we're formulating what we're going to say instead of listening to what they're saying to us. So trying really not to interrupt, keeping positive body language. So your arms open, you're inviting. You can lean towards them versus leaning away from them. Making sure that you're asking appropriate questions that have to do with what they're saying. Providing any evidence. So we'll go over some listening techniques of how you can provide evidence that you're doing it, whether it's something little or something big. Reflecting back on how you listened to them or on what they're saying, and just making sure that you're giving total attention. It's super easy to, especially I found in women, that we can multitask much better than men can. So it seems like we're listening and I know I'm paying attention, but they don't get that perception. And the perception is kind of everything in a listening situation of if they're going to pay attention to you. So the techniques for it is kind of, we'll go over these, emotional labeling. So you're kind of letting them know that you understand what emotion you think they're having. So I think that you might be frustrated, or I feel like you might be upset about what's going on. So putting an emotion to it to make sure that you're understanding what they're feeling and they feel like you can understand what they're feeling. Paraphrasing, which is just simply repeating back generally what they said so that they know that you understand, or they can correct you if you've misunderstood what they're trying. So they know you're putting forth the effort. Another one is mirroring. So you can do this in your words by repeating stuff back, but you can also do it in your body language. So if you have someone who's super closed off from you or who isn't being very receptive, you can actually mimic your body language to their body language. You don't do it immediately. It's a very subtle thing. But if you have someone that's sitting there with their arms crossed and they're just refusing to acknowledge you, and then you kind of get some communication going and you see them open their arms, then you can then open your arms and you're showing that you're kind of mimicking them. We like what we see in the mirror, so it helps. Minimal encouragement is the easiest one. So just when you're nodding, you're saying yes, you're agreeing, putting little words in there to say that yes, I am paying attention and I acknowledge what you're saying. So along with asking open-ended questions, so you can continue to let them give you the information. Using I messaging, so instead of directing it directly at them, they're trying to use words that would control them or anything like that, saying something that I think that this would be this. You're putting yourself on the line, and that helps it be a little bit easier to accept when you're saying, well, I think this, so you're including yourself in it. Effective silence, which can be super awkward and I'm not really good at, but it's essentially giving the time. People in an awkward silence will feel the need to fill it with talk. So giving them a chance to, you're not saying anything, wait a minute, and they may end up keep talking. And you can use that to your advantage in someone who's not really talking a whole lot or who's not being super descriptive. If you're waiting for them to continue speaking, they should get that feeling like, oh, I need to say more, and you don't actually have to push it. Perception checking is just kind of checking in to make sure that if they're saying what they're saying and their body language are matching. So you want to also clarify, which you can do with paraphrasing as well, to make sure that you're understanding what it is that they want or what it is that they're explaining to you. Structuring is if you have those people that come in and they have 14 problems all at once and they want you to resolve every single thing, you can structure it out and say, this is the thing I think is the most important. This is the thing think we need to address first, and then we'll follow through with these. So you're setting up a plan and an expectation for them, and then you follow through with that expectation. A lot of times, especially for SNDIP and stuff, when you see an upset patient or someone is starting to get escalated, it's because we didn't meet their expectation. A lot of times that's the reason that they'll give is, well, I expected this. But the problem is we never set up what that expectation was going to be. So structuring helps us say, okay, we're going to try and do this, but these are things we'll follow, and setting that up, setting you up and them up for success. Pinpointing is similar to the perception checking, where you're checking that the emotions match what they're saying, and then posturing goes along with that, positive body language. So making sure you're open, making sure you're reaching out to them, just kind of being kind in general. So when we're talking about things communication-wise, we have words that we want to avoid. So these are some of them. I pulled them from VIP. There are no. We really want to try and avoid saying no as much as possible. What's wrong? Come here is a command. You need to is a command. Or why? So the reason we avoid these, they're negative in their connotation in general. And if you think about it, when a patient comes in, essentially they're sick. They've lost all control that they have in their life. And we want to give them a little bit of control back that we can. So we actually, things that we want to try and rephrase to are asking permission if they'll come over and talk to us. How about we do this? Saying, I think it might be helpful to talk about this, kind of gauging that. So a part of it is, a lot of times you'll be in a situation where technically the answer to what the patient wants is no, but there are other things they could have. So it's structuring it so that you're saying, well, I can give you this or I can give you this, instead of just saying, no, you can't have this. Because they still feel like they're getting a choice. You still get to win in that they're still doing what you need them to do, but they feel like they're more in control of the situation. So biggest thing is kind of giving them that back, because being in a hospital and being sick is just not fun. It also allows them to feel more part of is that patient-centered care. So it's that feel more part of their own diagnosis, feel more part of their treatment plan, making sure that they feel like they're gaining something from this, or you're listening to what they're saying and they get to participate, even if it's not necessarily something that needs to be put in there. We used to use this in NADPRO, and I actually really like this in a clinic setting or in the hospital, and it's just a little thing to remember it. So respect is to make sure that you recognize that they may be scared, modest, or both. A lot of times it gets really easily forgotten that patients are people as much as they are diagnoses, or as much as they are wounds, or whatever they are. So understanding where that stuff might come from. So recognizing they'd be scared, modest, or both. Also encouraging them to share any concerns or requests for protecting their privacy or modesty. Supporting in their requests to the best of your ability. So the biggest example we use on that, and we do this for the most part anyway, is if it's a female patient and they have a male doctor, they need to have a female nurse or someone else in there as well. So understanding those kinds of things. We've actually had it the opposite way. When we were in clinicals, we actually had a male patient that just wouldn't take a bed bath because his nurse was a female. And we happened to have a male student nurse, and we're like, okay, cool. And we let him go in, and that was he just didn't want to undress in front of another female. So understanding that and asking that, and it took the better part of a day of the student nurse kind of like fighting with him about it, before she finally like talked through it and asked him why, and really that was the only concern. It's not that he didn't want to take a bed bath, it's that he didn't want her to do it. So support them as much as possible. That's the provide options with same gender care, so that's bringing in the female nurse or the male nurse if needed, or providers if possible. Evaluating the understanding of it. The key thing that I think falls by the wayside, and everybody knows this, is using the technical medical jargon versus using the like lower words. So I don't necessarily want you talking to them like they're a second grader, but remembering that they don't have a medical background and they may not understand everything that you're saying. So a perfect example of this happening was one of the first few weeks that we were in clinicals. We had a patient that was in the room. He had CHF, and we were trying to explain to him we had to do a teaching. So we're like, we'll go in and we'll talk to him about CHF because we have to get it done. Well, we were doing a wound change and stuff, and the student nurse went ahead and said, hey, I'm going to talk to you about CHF. He goes, okay, well, can I go ahead and ask you what that means? And we just assumed he was doing this because all day long he'd been asking us questions, and he'd like try to make us look good in front of our instructor. He was a great patient. And so she said that it had to do with congestive heart failure. And he goes, my heart's failing? And he had no idea what CHF meant. So he lost it. He got super upset, and like we had to bring the actual clinical instructor in. There was just so many people along the line had just said, you have CHF, you have CHF, this is CHF. He knew the letters, but he didn't know what they meant. So it was slightly overwhelming for us to be like, oh crap, and had to explain kind of what that was. Not that his heart was failing this very minute right now, along with everything else he had going on. So really making sure that they understand it at their level, and kind of gauging where their level is. There obviously are some patients that are super up there and you can explain it to them in the technical jargon, but gauging that appropriately. The other is to make sure that you communicate frequently before, during, and after any kind of procedure or exam, just to keep them so that you know that this is what I'm doing. This is what I'm taking care of. This is why I'm doing this. So they have some sort of understanding to kind of like reflect back to later, and they just feel more comfortable. And then the last thing that I like to always push is to thank them. It seems silly, but it makes them feel better about doing this. And there's another technique that I'll go over in just a second that has to do with thanking them as well. So it makes them feel as a part of it and kind of giving that sensation of doing it. The other one we talk about, and I love this from VIP, is last. Usually this is used for kind of a negotiation, but to use it just broadly across your life is super helpful. We go back to our active listening, so listening with genuine concern, making sure that they feel like you're actually paying attention to them. The other thing is apologizing. So it doesn't hurt us to say sorry if something is upsetting them. You can't necessarily say, sorry, this horrible thing happened to you. You can say, sorry that you feel this way. I'm sorry that this is happening. The easiest way to think of that is when you're driving in traffic and someone honks at you, most people, their first instinct is just say sorry, you raise your hand, you say sorry, you apologize. It de-escalates that situation immediately. So you're actually keeping everything from everyone getting upset, and you kind of make that person feel better, like, cool, does it matter what I did wrong? No, but now I'm going to be okay with what's happening. Solving in general, so trying to find ways that you can assist them, but also including them in on it. So that comes back to the phrasing, which I'm still not 100% good at, but we do talk about this as kind of swallowing the pride of saying, you need to do this, this, and this, versus saying, so what works best for you? What are the things, like I know we talk a lot about diabetic diets in nursing school right now because that's what we're going over, and it's like, well, you need to eat these things. Well, maybe that's not going to work for them, but if we can benefit them just a little bit, then we can slowly kind of try to get that better is kind of the long-term goal. So you need to exercise. Well, they're not just going to get up and all of a sudden walk 30 minutes a day, but our instructor had as a patient, and he was like, well, walk down your hallway once a day, and someone will follow you with a chair. And after about a month, he was able to walk down the hallway without the chair. Now he can walk to his mailbox, and it's just those little baby things that can kind of help and include them in the solution. So he was the one that talked about walking down his hallway. So he feels like he's part of it. So hopefully he's more likely to do it. And then also thanking them for bringing their concerns. So thanking them for allowing you to assist them or allowing you to talk through this with them. So they feel important in their care, especially when they aren't in complete control, like their body's doing what it wants, and they want to have a little bit of that control.